Well, on the eve of World AIDS Day, South African medical experts say there have been significant strides towards ensuring that people living with HIV access relevant medication. South Africa is in the process of testing an anti-retroviral injection which can be administered once a month. More than 5.5 million people are taking a combination of ARVs. Let's discuss this then. We are joined via Zoom by Dr. Nkhensani Nkhwashu, who's the Executive Manager for National Strategic Plan Implementation at the South African National AIDS Council. Doctor, a very good afternoon to you. Thanks for joining us.
Good afternoon, and good afternoon to our listeners.
All right, let's start here. The South African National AIDS Council a few months ago facilitated the signing of the new Global Fund grant valued at over 8.8 billion rand for the next 3-year cycle for HIV and TB response at GCIS offices in Pretoria. What is the latest regarding that grant, and what are the priorities, the key priorities at this point?
Okay, in terms of the signing of the grant, currently we've got partners who have been awarded the grant and they've started with the implementation on the ground on the selected district. And one of the key priorities, it's when it comes to the implementation of the anti-retroviral programs in our different districts that they are supporting. And also one of the key things is ensuring that we put people on treatment, and additionally we implement prevention related activities.
Yeah, and of course I really want to talk about this trial for the injectable HIV prevention drug. We know that there are trials currently underway and acceptability studies, including ones conducted in South Africa, that have shown that South Africans, or people in general I suppose, prefer this sort of way to be injected once a month than the oral pills for HIV prevention. Let's talk about that study and what you were able to find. I mean, I would imagine that getting an injection once a month is less cumbersome than having to take pills every single day. So let's talk about that, but also what the cost implications would then be for the country, because I would imagine that these would then be people could get them at public hospitals. What are we looking at here?
Yes, in terms of the injectable drug use, which is injected intramuscularly, it's one of the key breakthroughs when it comes to the treatment of HIV. And we are happy as South Africans that there are protocols and approvals that have currently been submitted with SAPRA. However, if you look at our current state in South Africa, I'm glad that you mentioned the issue of cost. That yes, as much as it's a breakthrough, it comes really at a high cost. When we study and see that, because Zimbabwe has actually started to implement it, we are looking at plus or minus 600 per patient, per injectable. So looking at the current budget that is available for us as South Africans, you can see that it's something that we are still advocating for the price to be reduced, because we will not actually even be able to put a quarter of our current clients that are already on treatment, not even thinking about the new ones. So definitely there need to be serious advocacy when it comes to reducing this amount, to ensure that as a state you are able to afford it. And we know that it will of great help to the clients that are currently receiving treatment.
Yeah. Talking about those patients who are receiving treatment, approximately 20 to 25% of new HIV infections are in young women in South Africa. What are we doing to tackle this? I mean, I'm sure it's great that we're having all these advances in terms of medications, but what would be great is, or better rather, is if we're not in fact having so many infections and so many infected people at the end of the day. Yes,
there is a lot that is actually happening on the ground. However, the key things that we need to note is that, that 25%, it actually comes as a cost to all of us. It calls for greater involvement, not only for the health sector, but for all the key stakeholders, especially at the community level, because all this HIV is fueled by the inequalities that we see outside there, and that, majority of us as South Africans, we experience on the ground. These inequalities comes at different forms. It comes in terms of our different socioeconomic status, and also which had a huge impact also when you link it again to gender-based violence. Hence, we are calling and saying that we need greater involvement for all of us on the ground to tackle these inequalities, which relates also to service provision, that majority of this group, especially when you look at the young ones, most of them, they are not able to access, sort of marketplaces where they'll get jobs, and also linking it back against to gender-based violence. Hence, it ends up fueling the whole epidemic again. So there's a call for a greater involvement for all of us to tackle these inequalities. Currently, there is treatment that is available for anyone who tests positive, that we can start them on. However, the greater work needs to be done to ensure that a majority of our young ones, they remain negative.
Yeah, tomorrow we commemorate World AIDS Day. Let's talk about that. This year, Equalize has been chosen as the theme for World AIDS Day. It means, everyone should work to eliminate the injustices that are impeding the fight to end HIV and AIDS. But one of the major factors is that, sex work is still criminalized. And, with that comes it being stigmatized in communities and leaving sex workers indeed to be vulnerable to HIV infections. This is something that, when you're speaking to this theme of Equalize, that we should be talking to specifically in relation to this. Yes.
From the beginning of the fight of HIV, for most people who have been involved with it, you will realize that, from the moment that we launched, there's been a call to decriminalize sex work. Because if we don't decriminalize it, as you are saying, that it puts, majority of South Africans, especially who are in that profession, at risk because they are taken advantage of. And the clients, they know very well that there is no protection. Hence, we are still standing and saying that definitely we need to decriminalize sex work in South Africa. It's something that we have been working very hard on it, actually, as with the Department of Justice, and at the same time with civil society and our partners, which are government and our private sector. There's still a call, even in the new National Strategic Plan for HIV, TB and STIs, that we are still putting that in forward and say it's time for us as South Africa to decriminalize sex work, because there's a greater risk upon the clients, and at the same time a greater risk upon those who are in that profession, that we are calling it, over and over again. However, if not all of us, we are together in the fight for HIV, we will not be able to reduce it. Hence, we are saying equalize access to services, equalize provision to treatment, and also equalize to make sure that not all of us, we are on the same level when we have to access services that are related to HIV, TB, and STIs. And of greater importance is that all of us, we should be treated the same, so that, we use it as a prevention strategy, because if we're not treated the same, we'll still have people who are taken advantage of. Hence, we'll still fight the epidemic over and over again.
All right, Dr. Nkhensani, thank you so very much for talking to us. That's Dr. Nkhensani Nkhwashu, who's the Executive Manager for National Strategic Plan Implementation at the South African National AIDS Council.